Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today we are going to be talking about the No Suprises Act, or NSA, that was designed to protect patients from unexpected and surprise medical bills, which has gotten a lot of coverage lately. But unfortunately for health plans, it's also created a complex and evolving landscape of disputes, compliance requirements, and rising costs. So today, this episode brings you Christine Cooper and Jack Dwornicki, who are going to break down what has changed, what's still unclear, and how plan sponsors can take a more strategic approach to managing independent dispute resolution, or IDR, provide negotiations, and overall plan spend. From regulatory updates to real-world insights, Christine and Jack offer practical guidance for navigating the NSA with confidence. So that's a large order. Let's get into it. Christine, I'm going to ask you first. Can you start by explaining what the No Surprise Act actually is and what problem it was meant to solve?
Absolutely. And thank you for having us. We're grateful to be here. The No Suprises Act is a law that went into effect in January of 2022. It was really meant to prevent patients from being balance billed, from seeing and receiving these, extreme surprise bills in three very narrow circumstances. So it was meant to cover emergency bills, out-of-network bills at an in-network provider, and air ambulance bills. So it's pretty limited as to the scope of the type of surprise bill that it is covering. That is really the idea behind the No Suprises Act. And it sets forth this very complex process in how these bills are supposed to be handled, removing the patient from that process.
Almost half of all Americans are actually enrolled in Medicare or Medicaid or at the VA, those that have healthcare coverage, where Congress and the states actually fix the provider reimbursement amounts, oftentimes below cost. And those programs typically prohibit balance billing. So short term, the No Suprises Act was a congressional attempt to kind of set prices and participant cost sharing in employer-sponsored plans for certain out-of-network providers.
And it really had several good intentions, shielding patients from bills that they had no power to control and reducing the cost of out-of-network healthcare spend by getting those out-of-network providers, insurers, or health plans to enter into contracts with each other. But as we'll discuss, I'm sure that really hasn't played out.
Yeah. Well, so that kind of leads to the next question. All these surprises. Jack, I want to ask you, what do you think has surprised health plans the most since the NSA went into effect?
I think most plan sponsors decided on simple compliance. They see this new statute, they see the regulations, they see the sub-regulatory guidance. And what they didn't do is they didn't adjust their plan designs in anticipation of higher in-network paid claims. So longer term, the NSA shifted what would have been participant paid out-of-pocket health costs into future increases in employer and participant paid premiums. So kind of shifted it from when you get the service, basically it'd pay higher benefits, increase the cost of the plan, raise the premium, and in turn raise both employer and employee contributions.
We alluded to this at the beginning, but I'd love to know what some of the biggest operational and administrative challenges are that plans are facing today with this NSA compliance.
So the process outlined in the statute seemed simple. It gave time deadlines and certain requirements and tried to define sort of the key terms throughout. But as this process has really played out, none of that framework has really stuck. And so there is a tremendous amount of uncertainty in this legislation and how the process is supposed to work and what's expected of a health plan. There is uncertainty in the law driven by the many lawsuits that are out there. There is not enough manpower. One of the biggest administrative hurdles for a third-party administrator, a health plan, an insurer, and even the small providers, not to leave them out, is the administrative time it takes. Many of these companies have to have someone dedicated to this process because of the strict timelines that they have to meet. So in the independent dispute resolution process, this arbitration process, both the providers and the plans and insurers their feet are held to the fire to meet certain deadlines, which are not natural deadlines under a typical appeals process in a health plan. So it's very time sensitive. And time sensitive in a way that isn't traditional or normal for the administration of a health plan. So that type of intense review and time structure is really what's causing, I think, a lot of heartburn for these health plans and insurers. There's just not enough manpower to move the process forward in the way it's intended to be. The other thing I would add to that is there's just a lot of misconception because it's a constantly changing and evolving process driven by these lawsuits that are out there. The misconceptions and staying on top of all that is a challenge for health plans.
Well, then, given those constraints, how are providers adapting their strategies under the NSA, and what does that mean for these plans?
So what we see as we handle these disputes on behalf of the health plans are, I'm going to put this into two separate buckets. One, you have your private equity-backed providers who are throwing everything at the wall and seeing what sticks. They are putting many ineligible claims through the process. They're putting pretty much everything. So they're flooding the system, if you will, with these IDR claims. That's one strategy that we're seeing out of providers. The other thing that we're seeing is the smaller providers, the providers that aren't abusing the system, they are actually trying to negotiate. They're trying to meet what the statute intended to do. They're trying to get to contracts. They're trying to negotiate these bills in good faith. So I would say we have these two buckets. What we're seeing more of is the private equity backed. I think there are 4 main providers that are eating up more than half of the disputes that are being filed. So we're seeing a tremendous abuse of the process, really just to create fear in the health plans, fear in the insurers, so that they're paying these bills without stopping to think if they're actually owed and really operating from that place. So those are the two different reactions we're seeing from the providers, and it's really driven by size of the provider.
We're also seeing some intermediate to long-term evolution, if you will, because of transparency, which is also part of the same legislation. Some in-network providers found out that they were charging less, sometimes substantially less than that qualified payment amount, the median or the average of what the network providers were charging. And as a result, some are renegotiating their fees with the network. And then there's the in-network providers who charge more than the QPA, but they're watching the IDR process and they're noticing, gee, there's a lot of folks gaining substantially greater reimbursements through the IDR process. And sure enough, those folks are also renegotiating the fees that they want to charge to be a network provider, to remain in the network. And then finally, some in-network providers, instead of renegotiating their fees, which is never an easy thing to do, they're just looking to leverage the IDR process. And we've seen some providers leave networks and become out-of-network providers simply because of what they see happening as a result of the No Suprises Act.
Then, Jack, are there trends that you're seeing that relate to dispute volume or outcomes and costs?
Yeah, it's pretty amazing what we thought we were going to get, or what Congress thought we were going to get, versus what we did achieve. Initially, the number of IDR submissions was initially estimated to be somewhere less than 20,000 a year. In the first 6 months of last year, 2025, there were 1.2 million IDR submissions. There were even more in the second half. So we're kind of starting to approach 5 million of these a year, which is like 250 times the original estimate. In terms of outcomes, providers initiate almost every one of these IDR disputes, and they win almost 90% of the time. The fees, just the fees that we pay to the folks actually doing the arbitration process, those were approaching $1 billion a year, and the total costs were approaching $5 billion a year now.
And to add to the administrative burden that we talked about before, it's almost $2 billion in administration fees just to be running these programs inside of health plans and inside of providers to maintain this process.
Nobody's really putting a price tag on the total at this point, but it's so far beyond what Congress intended, and it's all being ultimately paid for by the participants one way or another.
Yeah. In marketing terms, it's a whole heck of a lot.
A whole heck of a lot. Thank you.
Yep. And so, Christine, I'm going to come back to you because I'm curious, are there common mistakes or missed opportunities you're seeing plan sponsors make?
Yes, and this goes to some of these statistics that Jack talked about. So the 90% win rate by the providers, we don't know how that breaks down. We don't know how many of that 90% is full participation. The two things that I see plans do, one is hold too much fear about the process and immediately cave, calculate their QPA too high, force a QPA where there isn't one, where you can't get to a median in-network rate, and ultimately are not using the true legal avenues that are out there to protect themselves, to assert all the defenses that they have available to them, and then on the backside to properly address any enforcement attempts for these awards that are coming out. It's inconceivable to me that these claims went through a court of law the way that they used to, that there would be a 90% win rate on the part of the provider, because really what you're looking at, even in getting to a qualifying payment amount of QPA, is what is the reasonable amount. So that QPA is very important. It's an important number to be able to calculate and defend for claims that are eligible. I think there's a huge missed opportunity here to address the issue of ineligible claims. So many claims that are going through this process are not eligible. We have seen in-network claims that are going through the process. Well, this was never intended to touch a claim that is already an in-network claim. That doesn't stop because of the high volume and the low number of IDR entities that are touching these cases. There's not enough time for one of these claims to be really, truly, properly evaluated for eligibility, for a reasonable value. And the other issue with the process is it's a baseball style arbitration. So the IDR entity has to pick one or the other. They can't use their own reason and decision making to find what would be a reasonable rate for these. So I think we see a lot of plans acting out of fear. The other and bigger concern I have, because I think fear can be alleviated through, education and discussion, is just complete non-participation. And I see a lot of people who are burying their head in the sand, don't want to talk about it, don't want to address it. They just get the awards in, pay the claim out, and are not actively engaged in the process. And so from my perspective, I think education is really key to educate the non-participating health plans to get them engaged in the process. And I understand with the administrative burden, they may not want to do that themselves, but there are resources to be educated and to support your plans. I mean, at the end of the day, they are plan funds and they do have a fiduciary obligation to handle them appropriately and prudently.
Absolutely. And this is, for the foreseeable future, not going away. So as we look down the road, what regulatory or legal developments should these plans be watching?
They should be looking at enforcement. That's a huge one right now. So one of the massive holes in this statutory scheme is enforcement of these IDR awards. And court after court after court is coming out and saying there is no private right of action to enforce these awards. So even though providers are winning at a rate of 88%, if they try to go to court and enforce this award, they're being told no. We, the court, do not have the jurisdiction to rule on this. And that has been the Fifth Circuit down in Texas was the first one to come out with a decision. We just saw it in the Northern District of Ohio. We're seeing these cases in New Jersey. And I mean, it's really blossomed to all over the country, and they all seem to be saying the same thing. At the same time, the Supreme Court has decided not to take this up for review. So these laws that are being created by the district courts and the circuit courts, that's what we've got. So the providers are kind of in a bind as to enforcement. That's something we need to watch because right now it's very favorable to the plans. The plans should be utilizing this lack of enforcement to either negotiate much lower settlements out of the awards. There's a variety of opportunities within that. The other big one is the qualifying payment amount. That guidance should be coming out, something more specific about how that's supposed to be calculated. The providers have a real issue with the way that health plans and insurers are calculating that qualifying payment amount. So there needs to be more guidance and potentially there will be more lawsuits related to that as well. Those are the two biggies.
And so we've looked at the legal landscape, but beyond compliance, are there strategic actions that plan sponsors could consider?
So back in 2022, we offered a webinar highlighting how most plan sponsors responded to health reform. And most were in a compliance-only mode because health reform was implemented over a period of years. The most frequent question I used to receive every year was, well, what do we have to do now? Basically just compliance focused solely. So in 2022, after the No Suprises Act took effect, we recommended plan sponsors go beyond simple compliance and start thinking about taking some strategic actions, including looking at their networks and their plan designs with changes, adding participant representation to limit the NSA and IDR claims, to limit their impact, and to limit the number that you had to deal with. The other thing we suggested was adopt some HSA-capable coverage options to lower participant-paid premiums and to ensure participants were financially prepared for out-of-pocket expenses. Most people are clearly not prepared even for a deductible or a copayment. Unfortunately, most plan sponsors continue to focus solely on complying with the No Suprises Act, or as Christine mentioned, not necessarily taking advantage of all their legal avenues in terms of defending against some of these claims. So what that means is those plan sponsors who might adopt a strategic response, even today, could still achieve lower costs and a competitive financial advantage.
Well, I know this is a complex topic. It is one that is not going away. And so as part of this continued discussion, and the three of us are going to get back together in a couple of weeks for a webinar around this that will go to the Granite List audience. So I really appreciate the two of you spending time today diving into where we are now and what's coming. There will be much more discussion around this, and I'm excited to participate in it with the two of you. We are so grateful for the partnership with Acquium at the Granite List, and so grateful for the leadership that you, Christine, and Jack provide in this very complex area. So with that, thank you for being on today's episode of the Granite List Live, and thank you to our listeners for tuning in to another episode.
Thank you.
Thank you for having us.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.